It is Breast Cancer Awareness Month, and we've been talking about all of the ways that you can spread awareness to your friends and coworkers and family members and try to talk about preventing this cancer that, of course, impacts so many women nationwide. Dr. Ravi Patel from the Comprehensive Blood and Cancer Center joins me now to talk more about the developments in breast cancer research and just talking about the trends overall. Thank you so much for joining me. Appreciate it.
Thanks for doing this.
So, you know, every October, everything's pink, right? Everyone talks about breast cancer awareness. We'll get into that in just a moment, but I want to get your take on what do the trends look like right now? Are we seeing at all a decline? Is there any good news when it comes to breast cancer research and treating people who unfortunately are diagnosed?
Yes, no, that's an important point, Alex. And what has happened is everything which people have been saying, keep up your mammograms, keep your weight down, exercise regularly, do your breast self-exams, all of that is paying off. So what's happening is that it's slowly declining, but it's still there though. So we can't forget about it. And the breast self-exams, the mammograms sometimes, which people forget, not a good idea to do that. Just keep up with all of your screenings, exercise regularly, drink less if possible, keep your weight down, and all of those help reduce the risk of breast cancer.
Yeah, so again, it's Breast Cancer Awareness Month.
Yes.
As a doctor, it's almost, you know, it's like the cool thing to do, right? You wear pink, you buy things that are pink, and it becomes this big trend. But I do wonder, though, as a doctor, what do you actually want people to do, especially this month? And there's so much support, right? I mean, my mom had breast cancer, and I remember it opened my eyes when she was diagnosed to how important this month is to wear pink and to fund research when it goes into making sure that we can continue the research on breast cancer. But when you are talking about Breast Cancer Awareness Month, as a doctor, what do you want people to do this month especially?
If you haven't had your mammogram, please get your mammogram done.
Yeah.
Start a regular way to do your regular breast self-exams.
So what do women need to do in order, if they haven't done their self-exams, what do they need to do?
They need to have a very good way to examine both the breasts. A good way to do it is in the shower. And if you feel an unusual lump, bump, and even a rash over the breast, which is not going away, can indicate that something is going on. And there's no need to be discouraged. There's a lot more people alive today who have survived breast cancer than have died from it. So we're moving ahead now. You know?
And then when it comes to mammograms, what is the recommendation? When should women start? When should women, have their first mammogram?
Yes, if you have a family history of breast cancer, it's better to start early in the 40s.
Okay.
You get 40s, 45. Do it on a regular basis. If you have any family history of ovarian cancer, for example, ovarian cancer and breast cancer can also be connected. So make sure that, you get your screenings with your physician done. And the breast self-exam is very critical. Many times people will ignore a lump, think that, it's just something which is relatively benign.
Right.
Doesn't work out that way. It's better to just alert your physician, let them make the decision whether it's something relevant or not, and get a biopsy if needed.
And making sure that you follow that schedule and getting mammograms on a regular basis, right?
Particularly, yes.
So how long should, putting it in the calendar?
Yes.
How often should women get a mammogram?
Every year.
Every year?
Every year.
Okay. I'll say, my mom, she followed the advice and she would get her mammograms every year. And one day, her mammogram showed that she had breast cancer. This was over a decade ago. But because she was so diligent about getting her mammogram right when the calendar said it's time to get your yearly checkup, your yearly mammogram, the doctor said we're able to actually attack this.
Yes.
And she was, and cure it. And sure enough, she of course went through treatment but was able to cure it because she was so adamant about getting her mammogram.
Beautiful.
I want to talk about some of the clinical trials because you've got these clinical trials with UCLA. I always think it's interesting. Your looking at new ways to treat breast cancer and different types of cancer.
Yes.
What's going on right now, and what is some of the good news that you have for us?
Very good news, because there is a kind of cancer which is called the HER2 positive breast cancer. There's a HER2 gene. Fortunately, there are new drugs which are being developed for this HER2 gene. So patients who have progressed with metastatic cancer, we have new trials for them. There is another kind of breast cancer, extremely aggressive, which is called triple negative breast cancer. So we're doing trials with UCLA on using immunotherapy early on in triple negative breast cancer. Very, very aggressive cancer. Patients can die very quickly from it. And then also on certain hormonally driven breast cancers, we have a combinations of new drugs which are combined with what are called hormonal blocking drugs.
Dr. Ravi Patel, thanks so much for joining us. I know this is such an important topic. We're going to continue to talk about Breast Cancer Awareness Month throughout this month. Thanks for coming on. Appreciate it.
Thank you.
All right, we'll be back with a look at your forecast after this.